Welcome to The Gut Show. I'm your host, Erin Judge, registered dietitian and founder of Gutivate. I'm also your fellow IBS warrior. Our goal on this side of the internet is to empower those with IBS and digestive disorders to understand their gut better, to have a healthier relationship with their bodies, and to make confident choices to improve their digestive health. During this season, you can expect a conversation around a hot topic related to gut health, digestion, and IBS. As a disclaimer, I am a dietitian, but I am not your dietitian. So everything covered in this episode is meant to be educational and is purely information that you can take back to your healthcare team in order to make the best decisions for you. If you're new here and something just doesn't feel right in your gut, if your symptoms have led you to this podcast, I invite you to start by taking the quiz, What's Your Poop Personality? Your personality type will unveil what your symptoms may mean, what may be causing them, and what you can do about them. This is a free quiz and you can take it today at gutivate.com or find the direct link below in the show notes. While you're going to take the quiz, let's jump into today's episode. Now for a quick word from our sponsors with resources that might support you. Is a gluten-free diet just not cutting it, or maybe not even necessary when it comes to chronic symptoms like bloating, gas, and pain? Research actually shows that in those without celiac disease, it's actually the FODMAP, the carbohydrate fructan in wheat, not gluten, that causes symptoms most often. This means that you may not need a strict gluten-free diet to see symptom relief. And it means that if you are reacting to fructans, there may be more foods in your diet beyond wheat that are causing you symptoms. This includes foods like garlic and onion, and even some fruits and vegetables that can sneak their way into your diet and contribute to those chronic symptoms. So you can choose to limit these foods and reduce your overall fructan intake in order to avoid symptoms. You also have the option to break the fructan down using FODZYME, an enzyme blend that targets fructan, lactose, and GOS FODMAPs, and that will help you break these FODMAPs down to then prevent the symptoms. Learn more about FODZYME in the show notes, and you can use the code THEGUTSHOW for 20% off your first order. Did you know that you can now order your own gut health tests without waiting months for a doctor's appointment? Gemelli Biotech offers trusted, science-backed, at-home tests for conditions like SIBO, EMO, ISO, and post-infectious IBS. Their Trio Smart Breath test measures the 3 key gases, hydrogen, methane, and hydrogen sulfide, to detect different forms of microbial overgrowth. As for those with IBS symptoms, IBS Smart is a simple blood test that can confirm post-infectious IBS with clinical accuracy. Validated by the leaders in gut health, these are tests that you can trust and tests that you can take comfortably from your home. So go to getgutanswers.com to find out which tests are right for you and use the code ErinJudge25, all one word, ErinJudge25, to save $25 on your order. And now let's get back to the show. Welcome back to The Gut Show. I am excited for today's topic because we're going to talk about something that I get asked about almost daily on social media and online, and that is whether gut health supplements actually work. Which ones may work, what might be worth your money, what is not worth your money. Supplements are one of the, there's this debate on like conventional medicine and like pharmaceuticals and the wellness, quote unquote, wellness industry that's primarily supplement driven and program driven, and how much money they make. And the supplement industry is making more than the pharmaceutical industry in a lot of ways, and has become more of a present thing in all of our lives, especially if you deal with any type of symptoms or health problems or health goals. You're probably bombarded with supplement recommendations from your favorite influencers, professionals, from ads, all of those things. And so supplements have become part of our daily life in a lot of ways. And in some ways, supplements are incredible. They are there to truly supplement what you're doing through your diet, lifestyle strategies. They're meant to be an alternative to certain medications in some cases, and they can be extremely helpful and a valuable tool for symptom management and for the management of a condition. However, supplements can also be tricky because in the US specifically, the supplement industry is not very well regulated. So some companies and some supplements can go through third-party testing to prove that they are what they say that they are, but a lot of supplements
are not necessarily tested. And so you're really having to trust the company that's producing the supplement to know that that is what you're actually getting. And then in addition to that, a lot of supplements aren't really studied in terms of their risk and safety long term. With medications, we see a little bit more of that data when we're going through like FDA approvals. Like there are like different stages that a medication has to go through with different testing and populations, and then that's monitored over time. And so we see a little bit more data around the safety of a medication and the efficacy for certain conditions or problems because of the amount of research that's needed for approval. With supplements, we don't really have that. And the problem with that is that we don't always know what is actually efficacious, like what is going to be proven to work. And then in addition to that, we don't necessarily know what's going to be safe. And you may see negative effects from a supplement right away. You may see negative effects down the road, and other problems that can occur from supplement use that you may not have predicted and we may not have known about because there's just not as much data available. And so it's really important to understand that supplements are not benign, they're not safe in all cases, they're not just trusted 100%. And when you're choosing supplements, it's important to be cautious of that and to be like kind of take on that responsibility that just adding a bunch of supplements in, like that can be a big intervention. And so you don't want to just do it without thinking twice. Like you want to know that any supplement you're adding has a purpose and that you are kind of testing that out and that you are watching how your body's going to respond. And with all best available information, it is as safe as it can be. And again, and your healthcare team is monitoring it. You're not just taking random supplements for random reasons, ordering random things off the internet, and hoping for the best. It's important to really understand what might go behind it. So before we get into some supplements and common ones that I get asked about that are promoted often for gut health and what is available out there and whether or not they may work. What do you do if you are considering a supplement and you're trying to understand if there's any evidence behind it and what the safety actually looks like? So Google can be your friend here. And what I want you to do is get a little bit more savvy at utilizing Google. So if you search, is this supplement good for this problem? So for example, are probiotics good for constipation? Google is going to pull articles to show that they are good for constipation, right? Which may not be fact-checked articles. And so what I want you to do is look at both sides when you ask the question for your first level of information. Is the supplement good for this problem? Can this supplement be harmful for this problem? Can this supplement cause harm in other ways? Is there risk to taking this supplement long term? Like gather some more information. Now, within those searches, I want you to look for peer-reviewed journals and studies to back this up, not just blogs from random people. If you do open a blog, look for citations of these studies. You can also go directly to a database for studies. So you could go to PubMed, that's a great option. You can go to Google Scholar, that's a good option. You can also in your search say, is this supplement good for constipation? Research and see what studies actually come up and read those studies to see what amount was used, what the population was like. Was this an animal study, a human study? Were there any adverse events noted? Kind of look at what's available there. There are some databases out there that you can pay for to have access to look further at the possible negative side effects of supplement use and what studies might back it up, but also what harms and risks may be available. So there are those options available too if you want to pay for that. Consumer Labs is one that some people use. But you can also, again, just utilize Google to find some of that information. Just ask those different questions and ask both the positive, like the hypothesis you have, is this going to be beneficial? But also ask the reverse question and see what information comes up so that you can more thoroughly evaluate that information that is available. Another thing that you want to look for are what are the different drug or food interactions of this supplement. And you may not have, again, a lot of information available to you, but some supplements can negatively interact with certain medications or have like food interactions that you want to be aware of. And that's going to be helpful to gather that information. Now, with all of this, like this is kind of navigating it on your own. Ideally, you are working with your doctor or your dietitian or someone who you can also share this information with and like have them also double check and look through this to make sure that any supplement you're using is right for your case and is also safe for your case specifically. But that's a good place to start on your own if you're trying to kind of figure this out. And when you are deciding what supplements to add, you do want to consider, okay, with all these searches and things that I'm doing, which one has the most widely available evidence for it? What doesn't? Start with the things that have some research behind them because you're going to know exactly what you're looking for with symptom improvement or like the outcome based on that research that's available. You're going to know how much of it to take, which like forms of it to take, all that stuff because you have the evidence available. The supplements that maybe don't have as much evidence behind them, or it's more bloggers and anecdotal evidence or like theories of reasons why something may work, but there's no clear evidence for your condition, you would want to save those for down the line if like other things that you're doing aren't working. And again, ideally work with your healthcare team to make sure it's appropriate for you. So with all of that in mind, let's get into some of the supplements and talk through them a little bit. The first one, which is a little bit easier for me to answer, are peppermint oil capsules. I'm thinking about things like IB-Guard as a common brand. Peppermint oil capsules, specifically IB-Guard, have been well studied in the case of IBS and digestion symptoms. This is the way that the capsule, specifically to IB-Guard, is formulated is that it's slow released into the small intestine and the colon. And in that method of release, that peppermint is able to relax gut muscles, reduce cramping, help prevent things like bloating and trapped gas, help with gut motility, and reduce pain. So these have been well studied when it comes to those specific symptoms. And the safety profile of peppermint oil capsules is very good, especially the ones that, again, are well studied. And so this can be an effective recommendation. This is something that a lot of doctors recommend, dietitians recommend if you are dealing with pain and cramping, especially around food. But you can also take it outside of meals because it can work in that way as well. So very much evidence-based, a great option, a very safe option to try for most people in the general IBS population. So something you should ask your doctor about if you haven't given that a try yet, and especially if you have those symptoms. Another one is ginger, and I'm not just talking about ginger tea here, or ginger chews or ginger food, but encapsulated like higher dose ginger capsules or supplements. These are often used to have a promotility or prokinetic effect, meaning help support that peristalsis of the small and large intestines, help kind of sweep out the small intestine between meals, and like move things along to prevent constipation, to help prevent bloating. And then especially in the cases of like small intestinal bacterial overgrowth or SIBO, kind of help prevent relapse or reoccurrence of that. Now with ginger, it can be very effective. There's not necessarily a lot of research backing it up. There's a little bit of data, not quite as strong as some of the other supplements that are out there specific to symptoms, but it does have that prokinetic effect and definitely works on the stomach and small intestine to help with stomach emptying and small intestinal motility. Maybe not quite as much with the colon just because of how it's absorbed and all of that as it moves through. However, large doses of ginger have also been shown to induce liver and kidney issues. And so it's not something that you would want to use too long or increase your dose of too quickly without consulting with your healthcare team. Overall, it is very safe. So in most cases, it can be safe, but used chronically, this can be problematic and something that you want to be mindful about. Along the same lines as ginger, we have turmeric. Now, turmeric and ginger can both be kind of anti-inflammatory and have anti-inflammatory properties. So they are incorporated in the diet very often for that reason. With turmeric, that is the main thing that you're trying to kind of target when you add it in. So it's used a lot with like autoimmune conditions or thought to help with like the immune side of things. It's not necessarily meant to be like pro-motility or prokinetic like ginger. However, turmeric supplements or curcumin, same name, or same thing, different name. These supplements have definitely been shown to induce liver damage, or one of the top causes of liver damage. So you could add them, they're not going to cause damage for every single person, but they are much more likely to cause damage. And so one that you definitely want to be careful with adding and not add without talking to your healthcare team. And honestly, the benefit is maybe not that strong. So adding in a food version in a smaller dose may actually be more ideal in most cases, especially when you do have other conditions going on. You have to take supplements for other reasons, like you're stressing your liver in other ways. Probably not the best thing to add. Another supplement that is often recommended that I feel like was getting a lot of attention for a while, but kind of stopped, is L-glutamine. Now, with L-glutamine, the theory is that it helps repair the gut lining, restore the gut lining, which is related to intestinal permeability or leaky gut, right? So if your gut is leaky, L-glutamine may repair that, and so it can be added for that reason. This is a little bit supported by research. So there is some research to suggest that L-glutamine at 15 grams per day, which is much higher than the dosages that are out there from companies, but 15 grams per day over about a 3-month period has improved IBSD, like post-infectious IBS cases with symptoms. The theory on it improving intestinal permeability hasn't necessarily been proven in humans, but that is the theory behind it. And so the thought is, well, we see intestinal permeability with these kind of post-infectious IBS cases. Adding L-glutamine over this period of time helps. And so maybe that is why. Like, you get L-glutamine from food, you produce it yourself, like it's amino acid. And so it's adding in a little bit more of that. And amino acids are building blocks of tissue. They help with tissue repair. And so it makes sense that it can work in that way. And it has been proven a little bit. So it's one I wouldn't use with all cases, but something that could be considered in some cases of IBS specifically, because there is some research backing it up. And anecdotally in practice, this is used more often and can be quite effective, especially when other interventions are just not quite working out as we want them to be. Collagen is another one that always gets its own attention, and it's thought it also contains amino acids like L-glutamine. It contains glutamine, so it has that plus other amino acids. It's a protein kind of complex, and the thought is those amino acids then help restore tissue, and so combating that leakiness of the gut, tissue integrity. It's recommended a lot for skin, right? And preventing things like wrinkles, because you're helping repair tissue, cell turnover, things like that. This has not necessarily been proven. So research is very limited, and the claims far outweigh the research that is available. So I would say with L-glutamine, we have some specific research on specific dosages and symptom improvement in IBS. We don't really have that when it comes to collagen. And in some cases, collagen may cause more symptoms like constipation. And for many people, it just doesn't necessarily do that much. So every person will respond a little differently. And we don't have enough evidence to say how much, which types, how often should you use it, what duration of time, what is it actually targeting. So it is definitely one of those things that you just try, and it's kind of trial and error without as much evidence really backing it up. There is some thought that it can have some anti-inflammatory effects, which might be helpful, but that's not necessarily proven. So we don't know if it's targeting that, but some people may see a benefit for that reason. One group that there is a little bit more push anecdotally, meaning in practice, for supplementation is the overlap with connective tissue disorders and hypermobility, which we would see in Ehlers-Danlos syndrome specifically. And this overlaps often with IBS. And so if that is something that you struggle with, there is usually a little bit more push towards collagen as supplementation. However, when we look at the actual research, this isn't necessarily backed up. So it's not something that's been proven through human trials or anything like that, but it is something that is recommended, again, more anecdotally based on theories of how collagen. Collagen is part of connective tissue, so thought is adding more of that may help with connective tissue, and might be safe to try, but it's not necessarily proven. So we do need some more randomized control trials when we look at collagen supplementation, specifically in IBS and with GI symptoms, because we just don't have it currently. And with these powders that we add in, a lot of them are naturally derived. And so they, for most people, may be safe, but powders are also known to have like increased levels of metals and things like that. And so if you're using this every day in large doses over a really long period of time because you think you need to have it in, then it could be problematic. So definitely something to consider. And then if you've been using it for a while and symptoms have not gotten better, or symptoms have maybe even gotten worse, it may be something to modify to see if it is actually working for you or might even be working against you. Not something that I would put on a priority list as like a high priority for someone to try, just because, again, we don't have enough evidence for its impact on symptoms specifically, as well as different conditions. Now, what about probiotics? We've talked about probiotics a little bit more on here and through my different socials and on our website and in our Warrior Summit in April, and all these different places, because probiotics are always a hot topic when it comes to gut health and IBS. And the reality is that we just really don't have a lot of consistent replicable data to support probiotics use. So it leaves a lot of practitioners, like those who are actually following evidence-based guidelines, kind of confused on, do we recommend them or do we not? So the deal here is that we do have a lot of research. It's not that there are not any studies like what we saw with collagen and some of these other things, right? With probiotics, there are a lot of studies that are out there. The problem is that probiotic strains, within even like one strain, there can be a very different like species between the strains, dosages or amounts of those strains, their method of delivery can change, and then the combination of strains can change. And so whenever you're testing this in different populations, if you're testing different strains and different pairings of strains, and like you have all these different things that are changing every study, and populations are changing every study, we don't have a lot of solid repeated studies within like one population with the exact same amount of dosing and the exact same pairing of strains and the exact same strains, to be able to say whether or not they work. And the research across all of those studies, especially with IBS cases, is mixed. Some show benefit, some don't do anything, so no better than a placebo, and some show negative symptoms and a opposite effect. And so we don't have enough evidence to say, yes, you should take probiotics, and yes, you should take this exact one. Now, are probiotics safe? Mostly. For the thought leaders in the SIBO space, that small intestinal bacterial overgrowth space, which does commonly overlap with IBS, a lot of those thought leaders will say no probiotics in those cases, not adding more microbes to the mix of overgrowth that's already there. Not a lot of data to support that necessarily, but it is a thought process. So there may not be a recommendation in those cases. However, in like the general kind of IBS population and general healthy populations, there is likely not harm to adding probiotics. There's no harm that we know of for the most part. In inflammatory conditions, there's maybe more harm, so it's different there. But IBS and then general healthy populations, no necessarily harm. What more often happens is there's just no benefit. And so you might be wasting money and time on probiotics that may not be working for you. However, there could be a benefit because, again, the research is there and there are some strains that are backed by some research. It just hasn't necessarily been replicated, or what was studied in terms of the exact strain or combo of strains or the dose of it, the duration of time. Like, it might not be available in a specific product. So it can be very hit or miss. And it is something I typically recommend clients only try once we've gotten through the more evidence-based strategies. If we feel like we're kind of at that last like 10 to 15% of symptoms, or just at that last wall that we're hitting, this might be something that's worth a trial. Now, what do you do if you are looking for a specific resource on the research that is available? There's a fantastic resource that is now out there that's called ibsprobiotics.org. And you're going to be able to sift through the different research on different strains for specific cases of IBS, its specific symptoms, and different populations within those groupings. And that can be helpful if you're just looking for what data does exist and then what specific products align with that data. If you're going to try it. Again, it's not something I would do right away or do first. I would also not start one without discussing it with your healthcare team just to make sure, again, that it's appropriate for you. But if you are wanting to kind of dissect the research a little bit and better understand what options may be available, that ibsprobiotics.org website can be really helpful. It was created by a dietitian in the GI space. And is very evidence, the evidence is a big part of it. So very much evidence-based.
Now for a quick word from our sponsors with resources that might support you. Are you struggling with bloating, constipation, or diarrhea, and you're still waiting to see your doctor?
Take control and get answers with Gemelli Biotech's at-home gut health tests.
The Trio Smart Breath Test is the only at-home test that is validated to look for all 3 gases that are associated with microbial overgrowth: hydrogen, methane, and hydrogen sulfide. That means it can detect SIBO, EMO, and ISO in one simple test. It ships right to your door, no appointment needed. You take it and you send it back, then you get answers. If your IBS symptoms started after a stomach bug or food poisoning, it could be post-infectious IBS. The IBS Smart Blood Test is a quick at-home test to help identify it. Fun fact, 1 in 9 people who get food poisoning will end up with post-infectious IBS, and most don't even know they have it.
With both of Gemelli Biotech's tests,
you'll get clinically backed results in about a week, and you can take them straight to your provider. No waiting, no referrals, just answers. Find out which tests are right for you at getgutanswers.com and use the code AaronJudge25, all one word, AaronJudge25, to save $25 on your order. You can also find all these details in your show notes.
As someone with IBS-C, I've struggled with symptoms related to food for the majority of my life, specifically FODMAPs. My personal triggers, beans, dairy products, garlic, and onion, would leave me feeling bloated and uncomfortable after meals, especially whenever I was eating out or traveling or living my life outside of my home, which meant I either had to just deal with the symptoms or eat bland, awful food and miss out on experiencing the social interactions and the joy of food. Finding FODZYME was a game changer for me. This is an enzyme blend that targets FODMAPs, specifically the GOS that's found in beans, fructan in the garlic, onion, wheat, and even different fruits and vegetables, as well as lactose in dairy products. I stash this in my wallet, my husband's wallet, every bag I own. I take it with me everywhere I go so that I can simply sprinkle it on my meals, eat with confidence, and feel my best after. If you want to try FODZYME for yourself, go to FODZYME.com and don't forget to use the code THEGUTSHOW, all one word, THEGUTSHOW, for 20% off your first order.
Are you taking a prescription medicine for irritable bowel syndrome with constipation or IBS-C? If symptoms like constipation, belly pain, and bloating are still bothering you, it may be time to try something different. Ibsrela tenapanor is a prescription medicine used to treat adults with IBS-C. Ibsrela works differently to relieve the symptoms of IBS-C so that you can focus on what's important to you. Ask your doctor if Ibsrela could be right for you. Do not give Ibsrela to children less than 6 years of age. You should not give Ibsrela to children 6 to less than 18 years. It may harm them. The most common side effect is diarrhea, sometimes severe, and your child could get severe dehydration. Stop taking Ibsrela and call your doctor if you develop severe diarrhea. Do not take Ibsrela if you have a bowel blockage. Tell your doctor if you are pregnant or breastfeeding and about the medicines you take. Other common side effects include swelling or a feeling of fullness or pressure in your abdomen, gas, or dizziness. Learn more at ibsrela.com/PI or call 1-844-IBSRELA and press option 4. Ready to try something different for your IBS-C symptoms? Ask your doctor about Ibsrela.
And now let's get back to the show.
Now, what about prebiotics or fibers? So prebiotics are food for probiotics. Probiotics are live microbes. And so with prebiotics, we know that there is a lot of research backing up prebiotic food intake and your microbiome diversity and the health of your gut microbiome. So increasing prebiotic foods has been shown to increase beneficial microbes because you're feeding these microbes, they're able to flourish, produce the byproducts that they produce, and those byproducts have beneficial effects on your body and so forth. So that we know works. And prebiotics versus like just general fibers, all prebiotics are fibers, not all fibers are prebiotics. So with prebiotics, These are certain fibers that have been shown specifically to target those beneficial microbes. So prebiotic fiber supplements that have that specific effect are going to be supportive for improving gut microbiome diversity. Now, kind of like with probiotics, the research here is a little bit mixed because different prebiotics have different effects, and there might be value in eating them versus supplementing them. That's a new thing in research currently. Also, some prebiotic fiber supplements have other effects than just the prebiotic effect and might worsen symptoms. A great example is inulin. Inulin is often added. It's a great prebiotic fiber. It's also a very high FODMAP fiber that causes more symptoms for most people. And so it's not something that everyone should take, and it may not be tolerated by everybody or have the benefits you're looking for because it's the form and the other kind of characteristics to it that it has. So that may be something to consider with that. But overall and generally, prebiotics, as long as, again, they're from a company that you trust and in that kind of whole food form, they can be very safe and can be a good option to try. It just depends on your case and the specific source you may choose. Outside of prebiotics, or I guess I could share some of the ones I like as a practitioner. The ones I use most often are psyllium fiber, acacia fiber, and partially hydrolyzed gorgon, which is in that brand Sun Fiber. These are all great options that are typically well tolerated. They've been studied in various cases of IBS specifically to help with symptoms. They also have prebiotic effects. It can be beneficial. Usually, if I'm increasing prebiotics for a client or a patient, I really want to go for foods. So I utilize these supplements more for their fiber content and fiber characteristics more than just the prebiotic effect, because you can increase your prebiotic intake, which might be even more beneficial and better tolerated than just supplementation. Which leads me to fiber supplementation outside of prebiotics. What else are we considering here? So fiber supplementation can be used to simply supplement your fiber intake and help you reach fiber goals. If you don't eat a lot of foods, a lot of calories overall, this can be a great way to meet higher fiber goals. If you're trying to increase your fiber and you haven't eaten a high fiber diet and you want to do it in a safe, isolated way, then the complexities of food, fiber supplementation can be helpful. Or if, like, when you travel or on the weekend or certain days your fiber intake goes down, you can supplement fiber to just supplement the day, right? Fill those gaps that may happen from time to time. You also might utilize fiber for specific symptoms. So when we are looking at characteristics of fiber, we have the solubility, the fermentability, the viscosity. So fermentable fibers cause more gas. So if you're supplementing any fiber, ideally you want low fermentable fibers that still have a prebiotic effect, which can be hard to find. That's where that psyllium, PHGG, and acacia kind of come into play. You also want to make sure that they're soluble. Insoluble fibers, boran is a great example of this. They're going to cause more irritation. And even for constipation, like, you want to eat your insoluble fibers that you get from the structure of, like, plants, fruits, vegetables, greens, things like that. You don't really want to supplement them because that may cause more symptoms and not necessarily have the effect that you're looking for. However, soluble fibers dissolve in water, and they can add a softness and a form to your stool. So if you have loose stool, it can be fantastic for adding form to the stool, and very evidence-based there, especially psyllium husk fiber. Banatrol or banana flakes has also been shown here in more significant cases of diarrhea. With constipation, the gel forming effect with soluble fibers can be really helpful. So PHGG, acacia, and psyllium. And then the viscosity is the amount of form that you get. So that Banatrol, again, for those more severe cases of diarrhea, is highly viscous. It's going to be really helpful at really forming stool. Psyllium is also more viscous. So if you already have large bowel movements, they're too thick, too formed, you may not want psyllium because it's more viscous. You may want less viscous fiber like a PHGG that might be better tolerated. So fiber supplements have been research backed for IBS in those specific cases. We need a little bit more human studies. And like I mentioned, there's some studies in the animal world evolving that are looking at over supplementation of fiber and like certain fibers isolated and how maybe too much of a good thing is not a good thing. We don't necessarily have that data fully yet, and we don't have our human data yet. Our human data suggests that these supplements can be highly effective and very safe, and can be something to use. Now, some fiber supplements can negatively interact with certain medications, so it may be ideal to take your supplements away from medications. And some supplements may not feel good in the body, so that would be something you would talk to your healthcare team about, where the risk is more symptom-based than like liver damage or kidney damage or anything like that. But still something to consider and make sure that you're aware of before you just start a supplement and take something random. Now, unfortunately, a lot of fiber supplements on the market are mixed with like greens powders and then probiotics and all these other things and collagen. I usually don't recommend that because you can't really test if something's working for you when you have all these things in the mix. And you're also typically paying way more money for other things like the collagen and the probiotics and the greens powder that probably is not necessary and not evidence-based compared to the fiber alone, which is heavily evidence-based, that is often cheaper. So that is something to also consider with that supplement. Now, what about enzymes? Enzymes are like molecular scissors. They help break down different compounds in foods so that we can absorb the nutrients that we take in. So you have different enzymes for all the different nutrients that are inside foods. You also have enzymes that break down like fibers and things like that. Enzyme use is very high in the IBS population, as well as those who deal with gut issues. It's usually the first thing people tend to recommend online because the thought is that if you're not digesting food well, take enzymes. It helps you digest food. It can be a benefit. And in some cases, it is that simple and it can be that helpful. In a lot of cases, the enzymes that are used aren't targeting the foods that you're actually eating or the foods you're struggling with. So you might be taking a lot of things you don't necessarily need. So what can you consider? Enzymes haven't necessarily been well studied in IBS. We need more research on this. Now, certain enzymes for specific problems in IBS have been studied. So lactose intolerance is very common among those with IBS and gut issues. Lactase, which is an enzyme that breaks down lactose, that supplementation has been well studied and is very safe. Lactate is a common brand there, but there's a lot of brands out there on the market. Alpha-galactosidase, which is in that common brand Beano or Bean Assist, this has been studied to break down oligosaccharides, specifically the GOS that's in beans, which is why the Beano got its name. This has been studied and is very safe. When it comes to taking general like lipases, proteases, kind of random supplements, not necessarily evidence-based for the IBS population or general gut issue population, there are high doses of these more general enzymes that are available through enzyme therapy. PERT is an example of what that's called, but this is for pancreatic insufficiency because your pancreas releases the majority of your enzymes. And there are some people that have insufficiency of this production and release of enzymes. And so they are prescribed high doses of enzymes they take with meals. That is evidence-based in those cases. The dosing is highly personalized and the testing sometimes is inaccurate. So that's a bit of a complex topic too, but the just general enzymes off the shelf are typically not recommended. Now, one enzyme we often recommend that's on this episode as an ad is FODZYME. FODZYME contains the lactase for lactose, that alpha-galactosidase that I mentioned, and then their proprietary enzyme for fructans called fructan hydrolase. And this has been evidence-based within, it's called the SHIME model, which is a model of the GI tract showing that it actually breaks down those fructan molecules in order to help you absorb the fructose out of the molecule to then reduce the symptoms in the gut. It's naturally derived, and so it can be very safe. And there is some data also within humans to show like some symptom relief as well as no adverse outcomes. Now, with all enzymes, the safety data, we don't have a lot, but the way that they work in the body, like most enzymes aren't absorbed themselves, like they're working on the food we eat. And so they can be very safe. So if it is something that you're just trying, again, I would try something that targets the food you're eating that you have problems with. I love FODZYME because it targets the common FODMAPs that cause symptoms in IBS. So it's a very simple one to use in that regard. But if you're trying to just target lactose, just take a lactase. If you are, you got to know what you're targeting. If you're taking these random supplements and just random enzyme blends, like you might be targeting, but like you also, again, might be putting a lot of things in you don't necessarily need. And that can be a waste of your money and also be confusing when you're looking at what's working or not working for you. So that's something to consider. But the safety tends to be pretty good. And so again, talk to your healthcare team, but it can be very safe as something to try. It just may not be your top priority, again, unless you're targeting those specific foods that we know certain enzyme supplements break down well. Again, lactase, alpha galactose, and that FODZYME blend tends to work really well. I briefly mentioned greens powders, and I'm not going to spend as much time on these. These are not necessarily evidence-based and highly unnecessary in many cases. I think this has been debunked well on the internet, but for some reason still pops up all the time or is added to all these products, and then they raise their pricing because they have these greens powders in there. Not necessarily the best option. Now, are these bad? Not necessarily, as long as they are what they say that they are. And like I mentioned, powders get tricky because you really want to make sure any powder you buy is third-party tested, because they can easily be contaminated. And a lot of these greens powders, like we have no idea that they are what they say that they are. And some that are tested then, like for research purposes and comparing different brands, have shown that often they're not what they say that they are. They also tend to have a lot of things added to them that can cause more symptoms. So they're never something I recommend for IBS and gut issues. If you're taking one that you love, great, make sure it's third-party tested and trusted. You know what's in it, but it's not necessarily the cure it claims to be. And so usually not worth the money. And again, not really well studied versus like eating foods. And there is value in foods in their whole forms over just supplements in these more isolated forms. We're seeing that with fibers and things like that. So it is really important to consider food first, and you can get a good intake of greens through your diet. If you're in a place where you can't, a multivitamin or a greens powder that you're kind of using like a multivitamin could be an option, but it's not going to be as strong long-term as the food. And you definitely want to get to that first. The last supplement that I'm going to talk about is magnesium. And in this, talk a little bit about laxatives. So magnesium is one of the hottest supplements currently. And there's a thought that most people aren't getting enough magnesium and might be deficient in magnesium, and that can cause a host of problems. So there are different forms of magnesium that do different things in the body. So magnesium is thought to help with like sleep and relaxation. The forms that have been the form that's most helpful for that is the magnesium glycinate form. There's also some belief that magnesium can help with like headaches, nausea, like migraines, things like that. That glycinate form might be a little bit better there. There's some other forms as well that might be beneficial there. But when it comes to gut symptoms, the biggest benefit is magnesium's treatment of constipation. Magnesium citrate and oxide are two forms of magnesium that are less bioavailable, meaning we don't absorb much of them. So they make their way to the colon, not absorbed, and they pull water into the colon, which is an osmotic effect, making them osmotic laxatives. So as you increase the dose, you have an osmotic effect in the gut, which kind of flushes it out and gives you that laxative effect, very similar to how Miralax works. With magnesium citrate and oxide, you are still absorbing some of it. So high doses over time can be problematic for liver, kidneys. So they're not necessarily safe in all cases, but in the right dose, so in the smaller doses, they can be fairly safe and effective for treating constipation as a laxative and are often recommended. It is important to think about those forms because you might be buying a form that doesn't have that effect, which means you wouldn't get that benefit from it, and you'd be getting a different effect. Now, other laxatives, osmotic laxatives are considered safe because of their effect. They're not habit forming, and they tend to be very well tolerated and very safe. Miralax specifically is not really absorbed in the body at all. So it just has that osmotic laxative effect. So in that way, it is very safe because we don't absorb it at all. Now, does it impact the gut microbiome and other things? Like we definitely need more research on that. But in the right doses, it has been shown to be safe over time, which is why it is highly recommended by practitioners. Now, patients may prefer a magnesium route versus a Miralax route. They work very similarly. Some people see benefit in one versus the other. All bodies are a bit different. Now, stimulant laxatives and stool softeners can be more habit forming. And one stimulant we often see is senna. Senna is a natural stimulant laxative that's often available through like tea, things like that. You can get it off the shelf. It is habit forming and should not be used every day. It is something that you only want to use sporadically, occasionally as needed, because what that does is it kind of overtakes that movement of the gut and like forces movement to flush the colon out and reduce constipation or treat your constipation. Osmotic laxatives are more safe long-term versus stimulants. Now, stool softeners tend to be kind of more stimulating, but kind of fit in the middle. And there is a lot of debate on how safe they are or not. Should they be used chronically, even with stimulant laxatives? There is debate now about where they should be used. The research is not great. Even with like osmotic laxatives, we need more research, specifically in cases of IBS and gut conditions. And we need research over time to show how utilizing these laxatives over time really does impact the body and outcomes, because we just really don't have it. Like, we know they're generally safe, and we know that stimulants are generally habit forming and can be dependent forming, especially when they're abused and used at high doses, which we see in a lot of eating disorder cases. But we don't really have the best research to know exactly what doses to use, where the limit is, how we utilize those versus medications. So it's a bit of a gray area that does warrant more attention. And again, something that you'd want to work closely with your healthcare team on. If you find that any supplement or laxative you're using, like, you just have to keep increasing and increasing and increasing the amount, then that is something to bring up with your healthcare team, because you might be getting into that gray area where things could be problematic, and we may need more of a kind of holistic approach to it to try to see other options that would be safer for your body, or know what we need to monitor over time. I know that there was a lot in this episode. I also know that there are probably 20 to 30 supplements that I did not get to. If there's any that you're dying to hear about, comment it. If you're watching this on YouTube, you can comment. If you are listening, you can go to my Instagram, send something there, post this on your story and share this episode, and then share what else you want to learn. And then maybe we'll do another episode covering some other ones that are out there. But I hope that this brief review and conversation is helpful as you're navigating some of the things that are available to you. The biggest recommendation and takeaway that I hope you're taking is that supplements are not safe in all cases. Supplements should not be used just randomly. They should be used strategically and with the guidance of your healthcare team. They can be effective in a lot of cases, but they're not always necessary, or you don't always need a million supplements all at once to see some relief. There are lots of other options out there. And also, supplements can be used short term. They're not always necessary forever and chronically. So take that information to your team and apply it to your healthcare plan the way that you need to. And next week, join me as we shift gears a little bit and talk about endometriosis and kind of dig deeper into some of the other conditions that are out there.
Are you listening to today's episode with the main thought being, what are the steps that I can take to get rid of my symptoms right now? While I hope that the information that we share in every episode of The Gut Show leaves you feeling more empowered and more confident in your body, it's not always going to solve your problem or give you a clear direction for your specific symptoms and your needs. The Master Method membership is an online program for the person with chronic digestive symptoms and IBS who wants step-by-step guidance to understand their body, address the drivers of IBS, reduce symptoms, and build resilience in your gut long-term. This membership includes a step-by-step course and a dietitian-led community that teaches you how to holistically address each symptom and the IBS drivers, how to reduce symptoms more strategically and with confidence, and guidelines for better gut health long-term so that you're not only thinking about today, but you're also improving your outcomes in the future. It is time to ditch the symptoms and get your life back. The membership is your first step. You can learn more and enroll at ibsmastermethod.com and use the code GUTSHOW, GUTSHOW, GUTSHOW for $25 off your enrollment fee.